Hi, Dr. Chandler. We just thought we'd make this video to show you the pump itself, make the subsequent email that I sent you a bit clearer. So this is the TCI pump. As you can see, we've got two of them. I've got one prepared on the pole, and I'm going to go through this one with you. So we have here our grab handle, so that's for carrying it. It's also, as you can see here, it helps the two pumps to line up. We have infrared ports on both pumps on top and bottom. And what that means is that these will talk to each other. And I'll go through that a bit later on. We have our grab handle there. So the pole clamp is just back here, and that will attach onto the pole, and I'll show you that now. So as I said, our handle fits into a groove, and it means that your pumps are aligned directly so that when they're talking to each other, the infrared ports are directly one on top of the other. I can tighten up my pole clamp here, and we're ready to set up the pumps. So in order to open the door here, we can just press our grey lever, our grey button here, and open the door. And in here we've got a our syringe clamp. So I can open that up, and if you listen now, the pump itself is turning on and it's opening up and extending the syringe driver arm. I have my syringe here. This is going to be my propofol syringe, so I'm going to pretend that there's propofol in here. In order to load it, I place my the shoulders of the syringe within the grooves, close my syringe clamp, close my door, and on the screen here you can see our color screen. It says press and hold to load syringe. So I can either press on the screen here, or I can press my number 1 key. So I press and hold my number 1 key, the arm moves in automatically and grabs the end of the syringe there. It's asking me what syringe I have, what syringe I'm using here. We will program the default syringes for Cork University Hospital into your configuration. For this, I'm using a perfuser, so I'm going to choose the perfuser. I can press my number 2 key, or I can press it on the screen itself. I can now set up my adult TCI here. So I go into my adult TCI folder, and it's asking me what I'm setting up. I have multiple options here. So we have the Elveld, the Schneider, the Minto protocols on here, but I'm going to go into Elveld, and we'll just use Elveld as an example. So I'm setting up my Elveld propofol. It's going to ask me now what my patient's weight in. So in order to change that, I can change that using my data buttons here. So I'm going to say the patient is 82 kilos. And here it's changed on the screen. I press my number 2 key here. The patient's height, I'm going to say, is 182 centimeters. So that's roughly 6 foot. Again, press number 2. And my patient's age, I'm going to say they're 46 years old. Now I'm going to press confirm. And the gender then, is it a male or is it a female? So number 1 is male, number 2 is female. So say it's female, number 2. And it's asking me, am I controlling it through the effect site or the plasma site? So I'm going to choose my effect site here. Now, Elveld propofol is set up. If I don't want this alarming, I can press my power button, and it'll go into a standby mode, an infinity standby mode. So it's not going to alarm until you're ready to use it. I'm going to turn on now my my remifentanil syringe pump. So I press my power on button. I already have my remifentanil syringe loaded in there. I go to my TCI folder, go to my Elveld remifentanil. You don't have to use Elveld. Just because you're using Elveld propofol doesn't mean you have to use the Elveld remifentanil, but for the case of this example, I will. And it's asking me, where do I want to get my patient's information from? So from my pump above, yes or no. So I'm going to press confirm yes, because it's looking for this pump above. That's sending an information, a signal through the infrared, looking for the information from my propofol pump. And now it's asking me to confirm my drug concentration. So we have this fluid, so you can adjust this. If you wanted, or if you had a standard configuration for your remifentanil, we can make this a standard drug concentration to reduce patient safety interactions. Press number 2 here, it's asking me to confirm. I'm not putting in this details again. So patient's weight is 82 kilograms. They're 182 centimeters tall. They're 46 years old, and they're female. Confirm, confirm, confirm. And I also want this to go to my effect site, not my plasma site. So now my propofol is ready, my remifentanil is ready. I have color codes here as well to say propofol is yellow and the remifentanil is blue. So whenever I'm ready, I can press my start button, and that's going to start delivering my propofol to my patient and start delivering my remifentanil to my patient. And that's it.